Hey, what's up, guys? It's Ben with Clinical Marketer here to talk to you guys about how to go about selling cash packages and the exact evaluation script that we use for in-person sales. So before we dive into this, I really encourage you guys to have a notepad out and take notes throughout this because this may very well be the most important training that you guys go through throughout this course, and is the thing that has allowed one of the most important things that's allowed me to scale my practice to where it is today. Okay, so this exact script that we're about to go over has generated over $1.5 million in my practice alone, and millions of dollars collectively from other people that have gone through our courses and have used this exact script. So it's super, super powerful. And it's also the script that allows us to charge over $225 per session across all three of our locations. So really encourage you guys to really immerse yourself in this training and make sure that you're taking notes throughout. So let's dive into it. So I want to preface and start by saying that this is designed for 60-minute evaluations. Can be probably done in 45 minutes. Some people like to do 90-minute treatments, and that's fine too. It's probably better to have more time than not enough and feel rushed. But we find that the sweet spot is 60 minutes. So again, you guys can kind of revise this and kind of formulate on what you guys find works best for you. But we found 60 minutes is a perfect time frame for this exact script. So number two that I want to talk about and preface is stating that you do not need to use this script word for word. All right, make it your own to a certain extent. Take the main meat and potatoes of it and the general concepts, and you can spin it into a little bit different ways and wording and posing questions in a different way than what we have given you. All right, but make sure that you're keeping most of this the same. Okay, it's just the wording you can change up to match your personality style and how your preface preference on how you communicate. So, for example, in my practice, we have the same systems and everybody goes through the same training, I tell them the same thing. Make sure that you are using this to match your personality. So it's even different, just slightly different from PT to PT in my practice to match personality styles. So make sure to take that into account. So let's dive into it. So the first stage is we want them to feel welcome. All right, we need them to kind of let their guard down a little bit and feel comfortable kind of being vulnerable with us and letting us into what's their primary concerns and what's bothering them and what their ultimate goals are. Okay, but if they have their guard up, you're not going to be able to really get into what's truly motivating them. All right, so start by saying like, "Hello, Miss Smith. It's great to meet you. I've been reviewing your intake form, or I reviewed your intake form yesterday, and I'm excited that you're here. Okay, just curious, how did you hear about us?" Okay, so these are some questions that you can use to warm them up. You can also use other ones. It's just more small talk. Okay, so how did you hear about us? I like to ask this because it does give us some insight. First, it's a softball question that anybody can answer and can start easing them into opening up to you. And it also gives me good insight into how's our marketing, what avenues of our marketing are being successful, and how are people finding us. Okay, so you can ask like, what part of town are you from? You can say like, oh, nice, I'm over here in X area. You know, you grow up in this area, stuff like that. So this should be about 5 to 10 minutes long, and then asking them permission to go into the next stage. So are you ready to get started? Okay. Uh, you guys will notice a common theme throughout each of these stages. At the end of each of these stages, we ask permission to move to the next thing. Okay, why do we do this? Just make sure that they feel comfortable, and also a big thing is we are getting micro commitments. So if you guys have gone through the phone script sales training, it's a very similar concept. That research shows that if we can get micro commitments and micro yeses throughout the sales process, that when we go to recommend and pitch our package to them and what our recommendation is, they're much more likely to say yes to that as well. Okay, so moving to stage two, it's kind of the tee up. All right, so you want to state by like, excellent. I've helped dozens, hundreds of folks solve X pain, and I'm excited to dig into what's going on. All right, it gives people a lot of peace of mind when they know that this isn't your first rodeo treating somebody like them. Okay, so giving them that reassurance is huge. All right. So next thing that you want to do is mapping out kind of the plan. So here's the plan today. The goal is to figure out the root cause of your pain and where this is coming from. It could be a number of things. So we're going to do some tests to identify exactly what. Once I figure it out, I'll help you understand exactly what's going on so you have all the information that you need as well. Again, most of these people that are coming into the evaluation are looking for answers. Okay, they want an answer on what's going on, and they want a detailed plan on what the route going forward is to solve this. Okay, so you state from there. I'll put together a detailed plan to resolve this issue forever. Does that sound good to you? Again, a micro commitment. All right. Great. Before we begin, is it all right if I ask you a couple more questions that will help me make your visit today as valuable as possible? Again, another micro commitment. Perfect. So before we dive into the exam, are there any specific questions you have that you want to make sure I answer for you before our first visit ends today? All right. A lot of you'd be surprised on how many PTs actually don't do this. Okay. We have our kind of beliefs on what we think is valuable for the patient, but make sure that you are actually asking them exactly what they want out of the session today. Okay, because that's what's going to be most valuable to them. So don't just assume that a patient wants X, Y, and Z. Make sure that you're asking them, hey, what's the number? What are the specific things that you want answers on today? Because it's going to that's what's going to provide most value to them. Okay, and make this visit that much more powerful and worthwhile. Okay, so make sure that you write down what they say and circle back to it because you want to make sure that you address that. Okay, great, got it. And what are you most concerned about? Okay, so reassure them that they'll leave here today with the answers they've been looking for and what a clear path to recovery looks like. All right, stage 3 is moving into clarity questions. So pull up their evaluation accelerator form that we've given you guys that we really strongly encourage you guys to use for patients to fill out before their session and kind of go through that evaluation accelerator form with them, but make sure you're maintaining eye contact like 80% of the time. Okay, we want to have it up, but also show them that we're prepared and already know what it says. Okay, you shouldn't be going through this the first time for the first time with that patient in the room. Okay, make sure that you're reviewing it, and if it's really powerful when they can tell that you've already spent the time and invested the time to take this seriously and prepared for the session. Okay, so thank them and say, first of all, thank you for taking the time to complete the evaluation accelerator form. It really helped me put a good plan together for us today. So you're dealing with X pain and yada yada yada. Kind of summarize their evaluation accelerator form to build trust and show that you did your homework. Okay, I know you gave us some info on how this happened, but could you give me more details on how this problem started? All right, got it. So what do you feel is the biggest challenge or issue you're facing now with insert problem, okay, with the injury that they're dealing with? So this is going to really start peeling back the layers on what's motivating them, okay, and just really get on the same page with where their pain points are, okay? So like saying, okay, so what don't you like about X, or you can say, okay, and why is that important to you? Again, we're just kind of peeling those layers and doing what we call piercing questions. Okay, a lot of times people will give you more surface level answers, and so by asking piercing questions, it's going to help peel back those layers and get to their root, the thing that's motivating them the most. If you can do that, that's when you can really provide tons of value for these people and get them to move forward, okay, with what's best for them. Okay, so I'll state, tell me a bit about what you've done in the past to fix this. So the importance of this is a lot of times people don't actually realize how much time and money they've spent and invested in getting this issue fixed without an actual result. All right, again, it's making their pain point bigger by asking these questions. Okay, and it'll also tell you, a lot of times when you ask this question, patients will also give you insight into past experiences that weren't quite ideal for them and what they felt was missing. All right, so moving into stage 4, this is focusing on the future, on where they want to be. All right, so you can ask the question, so once this problem is fixed, what would you want to do? All right, it helps them visualize how their life would be different. And if you can help them if you can help them accomplish and bridge that gap between where they're at and where they want to be, again, it's just building immense value for them. Right. So what exactly are you hoping to gain from this experience, and what does a best case scenario look like for you? This is huge too because they're reiterating and maybe even diving deeper into what's motivating them and what their ultimate goals look like. Okay. We also asked, do you have any goals, races, or training events that you're trying to get back to or achieve? I like this because this can increase urgency of somebody taking action. It's because there's a hard timestamp. Okay, like let's say somebody has a wedding that's coming up, and they're trying to lose 30 pounds before this wedding in 6 months, but they can't lose the weight because their knee hurts and they can't work out or run. All right, or they have a race that they want to be able to do. They've done a race with their buddies for the last 10 years, and they don't want this to be the first year that they can't keep up with their friends and complete this race. All right. I like this because it increases urgency and gets people to take action on this. Okay. It also helps give you an idea on how much education you may need to do with regards to setting expectations and realistic goals too. Okay. Next thing is why is accomplishing that important to you? So we're kind of really diving deeper into, again, peeling another layer. You guys will see a lot of these questions are asking very similar things, but in a different way, just to get to what's motivating them the most and getting them comfortable to opening up more to you. All right. So for example, somebody might state that they want to get back to running. They have a race in 5 months, and they state or they like to. Another example is they are a runner and they have a really stressful job, and it's starting to impact their relationship with their spouse, their kids, and it's starting to impact their ability to perform at work. So that is a really strong motivating factor because now you're not just helping them with knee pain, you're also helping them get back to running, which is in turn helping their mental health, which is also in turn improving their relationship with their husband and or spouse and kids, and also improving them and helping them improve their work life, okay, balance, and also their work performance too. Okay, so that's a lot more motive. You guys can see how that is a much larger motivating factor than just helping them solve knee pain. That's the important of peeling back these layers and getting to what's truly motivating them and why it's so important to them. Okay, I guarantee you, a lot of other practitioners are not asking these questions, and especially if they're going to a network clinic that PT is spending 15 minutes with them on the evaluation. There's no way that they're able to get to these things, get to this level of understanding with them. All right, and people want to be heard. Stage 5 is obstacles, where they are now. Okay, you can say, I hear you, but I want to make sure we're 100% on the same page. You want to be able to do X, Y, and Z. Is that right? Again, another micro commitment. If you had to say today, how close are you to being able to do that? We like asking this question because it helps them realize why they need your help and increases that pain point of realizing where they're at and how far they have to come. All right. Next thing, what would you say are the biggest obstacles holding you back from achieving that goal? A lot of times people say, well, don't have the expertise to be or knowledge to be able to do this. And so it helps them realize that you are the solution to overcome this obstacle about what's holding them back. And then you can say another question is, just curious, if you don't solve this issue, are there any other areas of your life that will be impacted? This can be a really powerful question, especially with patients that come in that you just have a hard time. Like maybe it's a new injury and they don't have a whole lot of pain points quite yet. So you can say like, hey, does this seem to be getting worse, better, not changing? A lot of times they'll say worse. And then you can say, just curious, if you don't solve this issue, where do you see yourself, a year from now, if you don't get this taken care of? What other areas of your life will this be impacting? Again, it's future pacing. So it makes that pain point bigger for these patients. And it helps them realize they need to do something about it now versus later. And helps them start kind of visualizing what their life may look like if they don't do something about it. All right. Stage 6 is package. Kind of start pre-framing them, okay, and pre-framing the package. So you want to tell a story. Stories are super, super powerful and it's what people relate to. All right. So we can say, got it. You remind a lot of another patient I helped get back to X, Y, and Z. When they came in, they were struggling with X, Y, and Z, and we're trying to get back to X, Y, and Z and relate back to what their relatable goal was. They had seen several other PTs and chiros, physicians, massage therapists, and basically tried everything to solve X issue. Then they got referred to me by a friend. I took them through the exact assessment. We're about to do it together. We identified the real cause of their issue. And by the time they completed their package with me, they were back to doing X, Y, and Z and stronger and more resilient than ever. All right, you guys can really double down on other emotional things that this improved their life in other areas than just this. So you guys can really dive deep into that. So then he's going to say, so I'm pretty darn confident I can help, but honestly, I'm not 100% sure yet. All right, and this is where you want to dive into the assessment. So again, asking permission. Are you ready to dive into the assessment and figure out what's really going on? Another micro-minute. Stage 7 is the assessment. So say, excellent, let's begin. The ultimate goal with this is you want to use also, once you're done with the assessment, is use manual therapy techniques to test and retest to create noticeable difference or action-based wins that the patient can feel and see. Helping them see progress in one visit is extremely powerful for gaining trust and also giving them the peace of mind and assurance that, hey, this person just decreased my pain like in a half hour when I went and saw another PT or chiro and didn't see this much progress over the course of months, right? This person knows what they're doing, right? Even though we know a lot of times with manual therapy, it's short-lived, but it's creating a lot of buy-in for patients and showing them that and building trust with them. Okay, so you can solve the issue for them long term. So just again, it gives them assurance that investing in package will be worth it when that time comes. So throughout the assessment, you want to write down each issue that you identify and build a problems list. All right. So when you get done with the assessment, you don't want to just say, oh, to get over this knee pain, you want this will take 10 sessions. Okay, they don't really understand why it's going to take 10 sessions. It's knee pain. That's what they have wrapped their minds around. But when you start building this problem list and state exactly why this pain is happening, hey, it's due to weakness in this area, it's due to poor motor control in this area, it's due to these running mechanics, breaking down exactly list by list of what's contributing to their knee pain is going to help them realize why this isn't going to be solved in 1 or 2 visits, and help them realize that, hey, we got to address each of these issues to overcome knee pain. It just helps them see that and spell it out for them, and they can use deductive reasoning on why this isn't going to be solved in just 1 or 2 visits. Okay, and this is also going to increase the perceived value of our package before we share our recommendations. Okay, so stage 8 is unfolding. Remember, you don't need to take off your expert hat and try to put it on your sales hat. We're just simply sharing your recommendation based on past experience and then just shutting up. Okay. A lot of times people will talk the person that's going through the sales process will talk them out of the sales because they just ramble on. All right. And we'll go over that in just a little bit at the end. So all we're doing is giving them the best advice we can, and they can take it or leave it. You do not want to be recommending something based on what you think somebody can afford. If I like to tell the PTs that work for me that, hey, if the treatment was completely free, how many sessions would you recommend? That's how many sessions you should be recommending to patients. Take pricing completely out of the equation. Okay. So you can state, well, Ms. Smith, I can tell you're dealing with X injury. So I'm not surprised you're frustrated and came in today. The good news is I see injuries like this all the time and very successful with helping people with helping them become pain-free with running, okay, and getting back to X, Y, and Z. We've already seen some significant changes in our first session, which is really encouraging. This is great news because of what I'm seeing here. You won't need, an expensive MRI. You won't need to spend tons of time in a waiting room, checking in with your physician, getting massage every single month, and we can really solve this issue for good. Really like to do this because it's price anchoring. So when you get to the point of recommending the package, they already see it like, hey, well, this person already saved me. I was thinking about getting an MRI and spending thousands on that, or spending hundreds of dollars on massage, and If I invest in this, they've already kind of really paid for the program. Okay, so again, price anchoring, already building that value. So when you come to the point of discussing the package with them, it's a no-brainer. All right, moving on. I definitely have a few ideas to help with X injury for sure. But before I share that, do you have any questions for me about this? This can help just help you see if they have any other burning questions that they want to discuss. And by doing so, again, just building more value for them. So next stage is the presentation. So with what we have talked about so far, I'm very confident I can help. Here's why though, because I know everyone tells you that. You know how you were telling me that you're trying to X goal without pain and not being able to do it, making you feel X way. Well, based on those things and the fact that you showed up today and are willing to invest to get back to your desired goal with physical therapy, I'm sure you'd appreciate learning the exact process I use that sets us apart so you can achieve X result or desired goal. Okay. By stating these things here and stating what other patients may have told you with regards to their experience and what their pain points are, it helps you become more relatable and showing the patient that, hey, you do see this a lot. Okay. And that you are in a position to help them overcome those pain points and getting back to X, Y, and Z because you've helped other people do the exact same thing. Okay. So are you ready to talk about that? Again, micro commitment. Great. Here's the exact 3-step process I've helped people with the same condition get back to X, Y, and Z. So I'm not going to go over the Mount Dewmore training or poster. Make sure you go ahead and review that if you haven't gone through that already, but we insert it here. In a synopsis, it states the first step is to get you out of pain. This typically happens within the first 2 or 3 visits. The next step is to resolve the root cause of your pain that we identified here today. Lastly, to make sure that this issue doesn't come back, the third step is focused around strengthening and performance to not only get rid of this problem for good, but also prevent future injuries from happening. So the odds of you coming back are as minimal as possible. And the only reason you'll want to continue working with us is because you just love working with us. Kind of make a joke about this. All right. Be like, seriously, many of our clients wouldn't stop working with us, even if we tried, they just value the transparency we offer and the fact that we continually help them make long-term improvements in their health and wellness and have the ultimate body that they want so they can do all the activities that with their friends, family members on the weekends and go about their life without their body being the self-limiting factor with that. Okay. Stating the best part about this whole thing is that afterwards you'll be entirely independent and have the knowledge and skills to prevent or manage any future injuries for life. Does this process sound like it would get you back to X, Y, and Z? 9 times out of 10, people are going to say, yes, it sounds awesome. All right. I like asking this question because it also helps, again, bring any concerns that they may have about something that they feel might be missing and clarifying that. Okay. And then you can ask them, excellent, out of curiosity, why do you think this will get you back to X, Y, and Z? Does any part of this process stand out to you the most? Okay, this is what they're going to reflect and reiterate what they have found to be speak to them the most, and what is going to be most valuable. What's the most valuable piece that they pulled from that process? Okay, and you can double down on that. Love it. So here's what this looks like in action and how we'll get you back to X, Y, and Z as quickly as possible. You work with me at one-on-one for 60 minutes once per week. A lot of other clinics usually ask you to come in 2 or 3 times a week. We can get away with just doing 1 time a week, but it needs to be consistent. All right, pre-frame that we can get this done. As long as we keep that consistent 1 time a week, we won't have to do 2 or 3 times a week. Okay, this is also again building value because it's saving them a lot of time. And you really want to reiterate this so you don't get a whole lot of reschedules and cancellations and start having people come in every other week or 3 weeks. So, okay. So this is important to emphasize to reduce rescheduled cancellations. Talk about that. You have a few options to choose from, Ms. Smith. You can do a single visit at a time, or you can utilize one of our packages, which is what most of our clients do. This last part of which is what most of our paid clients do is really important because it helps normalize it. And people want to do what other people have done in the past. Okay, they don't want to be an outlier. Okay, they want to do what is normal and what other people have done in the past. All right, so based on your diagnosis and goal, and a dozen of other folks I've helped with the same issue get back to X, Y, and Z, I recommend you do the 10 visit package we have. This will cover your entire plan of care. It also allows us to commit to fully solving this issue with you and for you to commit to finally resolving this injury. Normally our rates are X per visit, but when you do the 10 visit package, it brings it down to X and you save X amount. Does that sound fair? Okay. And you kind of just want, at this point, you just want to shut up. All right. Like I talked about earlier, a lot of times people will kind of ramble on and try and building more value and all this stuff at the end after stating the pricing and justifying it. And it's going to lead to a conversion rate that's significantly less than if you just shut up. Okay. It's really tough and there's going to be some awkward silence sometimes, and that's okay. All right. Puts the pressure on them to make a decision, and you'd be surprised on how 5 to 10 seconds of silence is awkward, but you'll be surprised on how many people that when that silence is up, they'll be like, sounds good. All right. So a lot of times people move forward with this, but if they give you pushback on price or kind of explain that there's a cash flow issue or whatever objection they give you, the downsell that we like to use, and we have found great success with this, and a lot of people don't teach it or coach it this way, but again, we found great success with it, and that is downselling them into a verbal agreement. So, hey, it sounds like this is something you want to do, but cash flow may be getting in the way of you committing to this and getting back to X, Y, and Z. With that being said, if you're able to give me a verbal commitment to the 10 pack, I'll honor the discount and we can pay as you go. How does that sound? Does that sound fair? Right? Nobody's going to say, no, that doesn't sound fair. All right. People are going to really appreciate that. And we do this because, one, me being from the Midwest, I like to think people are good for their word. And sometimes we get burned, sometimes you won't. But most people will honor their word. Don't get me wrong, there will be some people that will, even though they give you a verbal commitment on this, will discontinue after 3 or 4 visits. There's going to be some people like that. However, the reason that we find success with this is we have found that the people that do the verbal agreement of the 10 pack actually continue on even at a higher percentage than people that have done a 10 pack pay in full, because they're conditioned to paying per visit, that when you get to the 9 or 10 visit, there's not like this hard stop. Okay. Versus like somebody that's done a 10 pack pay in full, there's a little bit more, it's kind of more black and white, and there's a definitive not a definitive endpoint, but there's more definitive endpoint than somebody that's been conditioned to pay per visit. Okay. So a lot of times this offsets the people that are discontinuing after 3 or 4 sessions, because we have more people continue on past those 10 visits on average than the ones that actually pay in full for 10. Okay. One thing I do want to note, and this goes, and I'm going to kind of paint the pros and cons of pricing sheets. All right. And so you guys can make the best decision on what you feel works best for you guys. And so sometimes people will use pricing sheets. Personally, we don't. I feel it pulls away the client's focus away from you and undermines your prescription. For example, when you pull out a sheet of paper and it's got a whole bunch of different options on it, and you slap that in front of them, it's kind of like telling them, yeah, hey, here's all our options. Which one do you want to do? People are coming in for your professional opinion, and what you put them in a box, they resist or always go with a cheaper option rather than what they need to reach their goals. And when you do this, and people go with the less amount of visits and the cheaper option, the likelihood that you can get long-term results and people are actually going to be happy about their experience and the results decreases substantially, which is going to in turn lead to decrease in referrals and patient satisfaction. Okay. So, and again, I want to reiterate, we understand wanting to give patients options, but when they come in they come in specifically for your professional opinion. Okay. Simply tell them exactly what they need. And if they push back, you can recommend a downsell. You can recommend and downsell them into a lower package. Okay. If needed, like, hey, totally understand, Ms. Smith. How about this? We do have a 6 visit package. Again, I strongly believe, just based on, I see this all the time, and have helped hundreds of people just like you. And I'm very, very confident we're going to most likely need 10. I understand that you've been burned by a lot of people in the past, so I understand your hesitation. Why don't we start with a 6 visit package and go from there? Okay. And I also reiterate that we have a 3 visit policy at ProKinetics, that you are going to know within the first 2 or 3 visits if this is something that is going to allow you to be successful. You're not going to be strung along for 10 visits, Ms. Smith, if we're not seeing results in those first 2 or 3 visits. So why don't we start out with the 6 visit package and go from there, okay? And see how those first 3 to 6 sessions go, and then we can discuss moving forward with the 10 visits if you feel like this is what's going to work for you. Does that sound fair? All right. So you can see we have multiple downsells. We have downsell if we get a pushback on the full pay. down into the verbal agreement, and then our downsell from there is the 6-pack. So we're not saying, oh, you can do a 10-pack, you can do a 6-pack, we got a 4-pack. That's when people are going to get really confused on why you need pricing sheets. If you give them all those options, because that's a lot of numbers to try and digest and whatnot. But when you are strictly giving them your professional recommendation, saying, this is, I'm recommending a 10 visit package, this is what our typical per visit rate is, this is the discount you receive by paying in full, they don't need to see a pricing sheet because it's very straightforward. There's not a whole lot of numbers because you've only given them one option or recommendation. So you don't get confused and don't need to see a pricing sheet. Okay. So again, there is benefits to the pricing sheet if you're giving them those options, but we highly discourage that and want to make sure that we have an opportunity to use downsells as needed. Okay. Instead of showing all of our cards. Reminder, sales are fluid, and it's not about what you say during your assessment, but how you say it and how you make your prospect feel. Okay. So like I said earlier, use this script as a learning tool and repeatedly practice it so you can master the framework. And once you have that framework down, the words you choose to say or even the order in which you use them won't matter. We recommend sticking with the script, but feel free to adjust it to fit your personality. All right. Want to also reemphasize, this is going to take some time. This is going to take some practice. Right? You're not going to get this down the first time that you do it. Don't get discouraged. It just takes reps and reps and reps. And by the end of within a month, you should be feeling pretty darn comfortable with this, and you shouldn't feel like you're doing sales at all. Okay. Again, you're just giving them your professional recommendation, and they are running with it and doing what they feel is. You just kind of let the cards lay where they're at, and let the patient make the best decision that they can for themselves based on the information that you provide them, and you live with the results. Okay. So hope you guys found this helpful, and if you guys have any questions, just let me know. Thanks, guys.